on Tuesday afternoons to discuss different topics in plastic surgery, and I get to answer your questions. Today is a topic that doesn't sound very good, but it's important to discuss. And it's what can go wrong in plastic surgery. And this is one of the things that causes the most anxiety in people when trying to decide if they want to do or not plastic surgery, because we always think of, our kids, we think of our families, and we think that maybe we're being selfish doing this, and then the people that depend on us are the ones who are going to suffer. So it is a sensitive topic, but it is important to discuss it. So we'll go over in detail about what are the risks. Let's talk about numbers that put it. Let's not talk about, the news that I saw, the story that I heard. Let's put it in numbers so we can make an informed decision. And I'm going to be doing this in Spanglish because that's what you guys want. So if you have questions in Spanish, I'm more than glad to answer them. But I'll be discussing it in English. But again, questions in Spanish are more than welcome, okay? So the first thing I put here is the overall complication rate, and it's less than 1%. What does that mean? Getting in your car and getting into an accident, 77% of people experience this in life. Are you going to stop driving? No, because you need to do it, right? How many people die in car accidents? It's actually 1%, okay? Again, everything in life is a risk over benefit scale, right? So we have to put everything on a balance. What do we do to try to decrease the risk of having a car accident? Well, we try to drive safely. We put our seatbelt on. We don't drive under the influence. We're aware. We don't text and drive. All the things that we should be doing to minimize that risk. But it's never zero. So that is why I started with this, because this is the same concept I am going to apply, and I apply in my patients to explain to them that there's always going to be risk with surgery, with everything that we do in life, but we do things to try to decrease that risk. And what is the other thing that is important? That you discuss it with your surgeon. You go over what are your complications, your complication rates in your center, and you as a surgeon, right? For me, here at Pure Plastic Surgery, complication rate is less than 1% as well. So it's nationwide, it's not zero. Do I have patients that have had an infection after a BBL? Yes, unfortunately, yes. But how many patients that I've had have had a complication like that? Very, very few, okay? So that is the main discussion that you want to have with your surgeon. If you have the conversation and surgeon's like, don't have any complications, it's one of two things. It's a lie, or that person is not doing surgeries, basically, okay? Because everyone that is doing enough surgeries will see complications. So let's go over what are the most common complications we see in plastic surgery. The one and only most common one on top of it is wound dehiscence or wound openings, especially in breast lift, breast reduction cases, okay? The majority, vast majority of patients is just a wound opening where the incisions meet. This is called a triple point or the inverted T. It's a wound opening right there, sometimes up here. We treat it with local antibiotic ointment and it heals. I know it's a headache. We don't want to see any openings. We want everything perfect. But the good thing, or the manageable thing about this complication is we just treat it with local antibiotic ointment and it heals, okay? I know it causes anxiety to a lot of people having an open wound in their bodies, but it is a complication that is easily manageable, okay? The other thing that you may see after a breast lift, tummy tuck, is spitting sutures. So basically, I don't put sutures on the outside, which is great, right? Nobody wants to have to come back and be removing sutures, but it doesn't mean that I don't put sutures. I have to put a lot of sutures. And actually, to try to improve wound healing and to have less tension on the scar, and the scar being very thin, we have to put a lot of sutures because tension increases thickness of the wound. Less tension, more sutures, causes a very thin line. So a lot of patients ask me, how do you get your patients to heal with such a thin line? Well, I'll put a lot of layers of sutures on the inside. Some of these sutures may kind of erode through the skin, and that's called a spitting suture. How do you see it? Basically, it looks like a pimple, like a redness, like a pinpointing on the scar. You see it weeks after surgery. You may even feel the little suture. People describe it as like a fishing. I forgot the el hilo. This goes here goes my Spanglish.
Fishing.
Anyways, so like that. So you can feel it like a little poke, okay?
Like a nylon.
Like a nylon. So if you feel this, clean it with alcohol. Take a clean tweezer, and you can actually pull the suture. Is it gonna unravel your scar? No, your scar is already healed. But you can just take away that little knot that it's causing the irritation. You can put an antibiotic ointment in it, mupirocin, bacitracin, and it'll heal in 1 to 2 days. Okay, so don't get too scared or uncomfortable with that, because it's something that it's going to be easily manageable. The second most common, I put it down here because this too had to do with breast, so I wanted to continue this kind of line. But seromas is actually the second most common complication in plastic surgery. So this one we'll see with liposuction tummy tucks, okay? Why? Because with liposuction, we kind of remove a lot of the thickness of the fat, and that space needs to kind of attach to the muscle and heal. When that doesn't happen, you can have a buildup of fluid. It's called a seroma because the fluid is called serous fluid. It looks like yellow, clear fluid, like apple juice kind of color, okay? So, and how do you feel it? It's basically, you start to see like a bulging in an area that was prior flat. And when you tap at it, you can even see a fluid wave, okay? So it starts to swell up, you tap it, you see a fluid wave, that's a seroma. If it's a small seroma, we're talking about a centimeter, 2 centimeter thing, very tiny, massages and compression is gonna take care of it. But if it's a larger fluid collection, we'll have to remove it. How do you remove it? With a needle and aspirating or removing that fluid, okay? I leave drains in my liposuctions and in tummy tucks to decrease the risk of seromas, but it's always a possibility, okay? Especially in, Willie, everything okay? Yeah?
Yeah.
Okay.
I have a message.
Oh, okay.
Important.
Message.
Okay.
He's like
fishing line.
Fishing line, thank you.
Sent to you by a patient.
You guys wanted Spanglish, so that's my first language is Spanglish, so that's why the Spanish comes up. So thank you for that. So with seromas, sometimes I was going to say with massive weight loss patients, risk of seromas higher, okay? So I may put you in a diuretic 2 to 3 weeks after surgery if your drains are draining a lot still, okay? So, and that is to dry up. I want the fluid to kind of go to your bloodstream and not to that what's called third spacing or building up in between the skin and the muscle, okay? So if you see or feel a seroma, it's usually in the first month, okay? First few weeks is when you're gonna see it. Easily treated with just needle aspiration, okay? Let's go back to these 2 complications. Infection risk, it's never 0, but it's very low in my hands. I am very, very strict with the infectious protocols, sterilization techniques. I ask you to start using Hibiclens, which is chlorhexidine soap, a week before the surgery. That kind of decreases your bacterial count in your skin. The most common causing agent of skin infections after surgery or surgical site infection is Staphylococcus aureus. Staph aureus is a bacteria that lives in our skin. So that's why it is so important to use the Hibiclens before the surgery. And there is an antibiotic ointment called mupirocin that's you're gonna put in your nose before the surgery, and that decontaminates Staphylococcus aureus that is resistant to methicillin. So it's not gonna die with the Hibiclens. Then we put that in it to kill it, to decrease risk of infection. Then I'm gonna send you home with antibiotics for a week. I'm gonna give you IV antibiotics during the surgery. And then afterwards, it is important to do not submerge in water, okay? There is some bacteria, especially one that is very hard to treat, that may be in the water, okay? So it's very important you do not submerge in water. After the surgery, I don't advise it for the first 6 weeks, okay? So shower is fine because the bacteria is not going to be submerged in there. It's going to shower, pat dry it, and then you're not going to have it like submerged to have time for the bacteria to kind of impregnate in the skin, okay? So infection risk, not zero. When are you gonna see it? 2 to 3 weeks after surgery, okay? After that, the risk of infection goes down significantly, so you don't have to worry about it. In the BBL or in the areas of fat transfer, how are you going to notice it? An area that was not very painful and starts to get very painful, warm, red, quickly give me a call, because we can usually treat it with PO antibiotics and it resolves, and we don't need to go into an admission to a hospital with IV antibiotics, okay? Majority of the infections, if they come up, are treated with pills. PO antibiotics is stronger antibiotic than I give you initially, and it resolves, okay? Capsular contracture is always a risk when we're putting implants, okay? Risk of capsular contracture is around 10%, okay? It's not zero. Risks of capsular contracture are higher in patients that decide to get their implants done through the areolas, through the armpit, or through the belly button. That's why I don't prefer to put it through those routes. Also, if we put it under the breast tissue or subglandularly, that's an increased risk of capsular contracture. So I prefer to put it under the muscle or under the fascia, which has also good coverage like the muscle, okay? So if you develop capsular contracture, you start to see it a couple of months after surgery, it may be up to a year. You can develop it years after as well. And there's different grading systems. It's basically how much that scar tissue around the implant is causing distortion. It can cause one breast to look higher than the other. It can also cause some pain. So if you start to see any difference in the breast, give us a call right away, because there's a medication I can start you. It's called Montelukast Singulair. It's a medication used for allergies, but it actually has been proven to help with capsular contracture and massaging, okay? So if you see it, give us a call right away. All of this are basically in the first few weeks. This one, you'll see bleeding hematoma, you'll see right away, okay? Hematoma, concern for hematoma is mainly in facelifts, breast augmentations, and tummy tuck, okay? And the reason why in facelifts is so important is because tension in the skin flap, what we elevate, can cause skin necrosis. So if you see that one side of your face starts to get swollen in that day or 2 days after surgery, the risk of hematoma in facelift is the first 48 hours. Then there's a need to go back to the operating room to decompress that skin, remove that bleeding, control the breathing, and then everything usually heals well afterwards. Same thing with breast implants. A breast augmentation, if you see one breast getting very swollen after the surgery, those first 48 hours, the best thing to do is go back to the operating room, take the implant off just to remove the hematoma, clean the area, and we put the implant back in. Short surgery, but it is worth it, because if not, you're not going to achieve good symmetry, and risk of capsular contracture goes high. Risk of bleeding also in liposuction is important, okay? So that is why it is so important to follow up with your surgeon afterwards to get your hemoglobin to good levels before the surgery, because there's always going to be bleeding with liposuction. We just want it to be controlled so you can tolerate that decrease in hemoglobin and do not need a blood transfusion, okay? So what are the things that I'm going to put you? I'm going to put you in iron and folic acid supplements before the surgery and to continue for 2 weeks after. I'm going to use a cell saver, which is a machine that basically filters what I remove with the liposuction and gives back to you the blood products, so the total blood loss is less, okay? And also it's important to have good pain control so your blood pressure doesn't spike and very high, and that increases your risk of bleeding. No Aleve, ibuprofen, aspirin, none of that for 48 hours and 2 weeks before the surgery. No alcohol. Alcohol increases risk of bleeding for at least 2 weeks before the surgery, 2 weeks after the surgery, okay? And the other thing that increases the risk of bleeding is a lot of the supplements that you normally take on a daily basis, okay? That is why I ask you to stop multivitamins, ginger, ginkgo biloba. All of those supplements increase risk of bleeding. So that's why it's so important to stop it before and to start it at least 48 hours after surgery, okay? And the one and only DVT-PE. We want to avoid this one as much as possible. Risk of DVT-PE is very, very low. But it is important, especially with tummy tucks, to be moving. The most important thing to decrease this risk is getting up and walking, okay? You can be on blood thinners, you can have your compression devices, but if you are in bed all day after your surgery, this risk is too high, okay? So it's important to, even the same day of surgery, you get up and start walking every hour for 10 minutes, okay? The other important thing is your hydration. When we get dehydrated, our blood gets thicker, okay? And that increases the risk of blood clots, okay? So how would you identify if you have a clot? Clots usually happen in the knee or calf region. So you're gonna see that your calf, ankle, foot on one side gets severely more swollen than the other side. Liposuction, BBL, tummy tucks are going to give you swelling in your legs, but it is a symmetrical swelling. When you see asymmetrical swelling, one leg more swollen than the other, that is not normal. Let us know right away. Also, pain in the calf. A lot of people are going to experience tingling sensations in the legs after, and that is mainly an electrolyte problem. It's probably you're drinking a lot of water and you're not drinking Gatorade or electrolytes, okay? And that you say like you cramping kind of pain or pins and needles, electric type of sensation. That is not a blood clot. A blood clot is like a cramp, but it's like severe pain in the muscle calf, like a cramp. That is not normal. That doesn't go away with hydration. Give us a call right away. Shortness of breath, that it doesn't improve with resting. When you're walking after a tummy tuck liposuction, you are going to get short of breath. That's normal. But it should improve when you're resting, okay? If you are resting and you're short of breath, that is not normal. You give us a call. What is the take-home message here? Anything, any questions in the post-op process, you're going to give us a call right away, okay? A lot of people tell me, but what about if it's 2 in the morning? So you give us a call. The phone number of the office is always connected to our answering service, okay? When you call after hours, it's gonna say that we're closed. Stay in line because that's gonna connect you to the person that's on call. And that person, it's either me, Dr. Wigriff, Jenny, our nurse practitioner, or Sarah, our nurse, are going to give you a call back and they're going to give you instructions on how to proceed, okay? You're never alone, we're always with us, okay? So let me get to some questions now, if you guys have it.
We have it. What we don't have is enough time, but...
Oh, okay.
I'm going quick. Do you guys use Mentor or Natrel?
Natrel, so that's the type of implants that we use. I use Allergan Natrel implants. With Allergan Natrel, the reason why I use them is because I've used them for a long time. I've had very, very good results with them. The result and the warranty response is great with them. So that's why I use them.
Hi, Dr. Vidal. Do you perform thigh lifts?
I do thigh lifts. Thigh lifts can be done with a crescent incision hidden in the crease, or a combination of that with a scar that goes down in the middle of the thigh. It depends on where is the excess skin.
Okay. How long do drains stay in after a lipo 360?
5 days. So when you come for the 5-day follow-up appointment, I'll remove it.
Any tips for someone considering a tummy tuck but has never been under anesthesia?
Anesthesia. Yeah. I mean, you're doing the right thing. You're coming here, you're getting, you're seeing the videos, getting educated. I think that's the most important part. And the other part of the job is getting your clearance, going to your primary doctor, checking your blood work, checking your heart with an EKG, making sure that you're up in health to tolerate. Anesthesia is very, very safe nowadays. I know everybody's scared of it, but it's actually safer to go under general anesthesia than to start doing these procedures under local with lidocaine toxicity, problems with heart rate issues during the surgery. So it is safer to do it under anesthesia if you're safe. If you're safe and if you're healthy.
Okay, this says, cover tummy tuck in Spanish. pero yo puedo invitarla a que revise el live de hace unos días.
Sí, pues mira,
Ok.
si vas a mi Instagram y en el YouTube channel también, vas a encontrar un live completo de abdominoplastia de tummy tucks en español.
Okay. Autoimmune disorders versus surgery.
So that's a tricky topic. The reason for it is because autoimmune disorders are usually treated with medications that block or suppress the immune system. The problem with that is it increases the risk of wound adhesions and infection. So the majority of patients that are, for example, in methotrexate, on medications like antibody medications that block the immune response are not a good candidate for surgery. If it's controlled and you're able to stop those medications 30 days before and 30 days after, then we can do surgery.
So excited for my arm lift with you in a few months. Queen of the arm lifts.
Queen of the arm lifts.
I love that. I'm gonna make you a crown of arms.
Yeah.
Is Cell Saver always utilized during your procedures? If not, how do we know if you need it?
All of my liposuction cases have the cell saver. Yes.
I think it's in our quotes.
Yeah, it is. So if you had a quote with us, you'll see it. It's something that it's listed in the quote. Sometimes you don't know what it is, so you don't pay attention to it. But all the liposuction cases that I do have cell saver in it.
How often should someone walk after a BBL, and when should they begin to prevent blood clot?
You start same day. When the anesthesia wears off, you're awake, you start walking every hour for 10 minutes.
Okie dokie. Can you combine a thigh lift with a BBL?
No, so thigh lifts, I can do a focused live on thigh lifts because thigh lifts tend to have the highest risk of wound adhesions, okay? The risk of wound adhesions is high because the incision is in the groin, it's close to your genitals, it's close to areas that are sweaty and not that clean. So having risk of wound openings and infection is higher than any other surgery. I don't like to combine it because I want you trying to keep that area as clean as possible and focus your intention in healing. So no, thigh lifts are done solitos by itself. Okay? Thank you so much, you guys. I know that this is a topic that it sounds a little bit scary, but I think it is important to discuss and to put it into context so you can make an informed decision. And I think knowledge decreases anxiety. When you know what are the risks, what are the percentages, which is very, very low that something wrong happens, and if it happens, how to manage it and deal with it, I think that decreases your anxiety because you're in control, okay? If you guys have any questions more about this topic, please DM me, put them in the comments, and I'll see you guys next week on Tuesday Tips.
And we're going to be talking about thigh.
Okay, so we're going to be talking about eyelids. Take care.
Ay, salí en el live de YouTube yo.